Texas doctors and pharmacists were supposed to start checking the state's prescription monitoring program this year.
But a new Texas law gives them a little more time before that mandate goes into effect, and KXAN's Steffi Lee explains why.
Doctors, in addition to bodies of government, need to partner better to control the opioid epidemic.
Dr. Deborah Patt feels the Texas legislature found a balance by delaying the mandate for doctors to check the prescription drug monitoring program to March.
What we'd like to see is more integration with electronic health records to make this process more integrated and more seamless for physicians.
Sometimes a client comes in at 10 o'clock at night.
Joseph Gorordo, who helps people with prescription drug abuse problems, says there's no need to rush.
I think that the whole deal with the PMP can be kind of a double-edged sword, right? Because the idea is that people won't be able to doctor shop and get different prescriptions from various doctors, but that also cuts off their supply. And very often, people with substance abuse issues are going to find a way to get what they need regardless.
Still, he sees the importance of having the mandate go into effect smoothly.
I think a delay can be beneficial if it's making sure that it is implemented correctly without hiccups.
Date it was filled, what the medication was.
And while that extra level of coordination will take a little more time,
This gives us better insight into who's prescribing these controlled substances and how often patients are filling them.
Steffi Lee, KXAN News.
Under this new law, the state will have to form an advisory committee this September of pharmacists and physicians from a number of different practices. They will make recommendations to the Texas State Board of Pharmacy about how to address system weaknesses and workflow challenges.
Another Texas law that takes effect September 1st limits opioid prescriptions for acute pain to 10 days, and they can't include refills. It does not include treatments for substance abuse, chronic pain, cancer care, or any end-of-life care. Beginning January 1st of 2021, all controlled substances must be electronically prescribed.